For the next few minutes, we're going to go over and discuss some of the issues related to colic, causes, and things that may help deal with that. I know from personal experience, our first child was colicky and it lasted about 3 months, and it can be very stressful for parents dealing with a child who cries and is inconsolable. You change their diaper, you feed them, you do all the things that a baby needs, and yet they have this very strong, very high-pitched cry, and they cannot be comforted or quieted, and it can be difficult. So you need to know what colic is, generally speaking, what are the main causes of it, and some possible solutions in alleviating it. So we'll begin then with a definition of colic. It is an excessive crying and irritability of an infant. So excessive crying and irritability of an infant. All infants cry for various reasons. It's their main way of communication. I'm tired, I'm wet, I'm hungry. They cry for all of these things, but if there's an excessive amount of it, and it includes irritability, and along with that you've changed them, put them down for a nap, or fed them, and yet they still maintain the constant, high-pitched, strong, excessive cry, then colic is strongly indicated in that case. Now, you don't want to confuse an infant's colicky cry with an ordinary hunger cry. When infants are very hungry, they can be quite loud, but the difference is, once fed, the crying stops. So hunger cries can be satisfied with food, colic cries cannot. Often when attempting to feed a colicky baby, they will push food away. They don't want food. It's not hunger that they're dealing with, but more than likely a gastrointestinal problem. And so most colic is associated with gastrointestinal issues. And these issues include things like hypersensitivity or allergy to cow's milk proteins. So either directly to the baby or through the mother. Issues of hypersensitivity or allergy to cow's milk proteins can pass from the mother to the child if nursing, or once again, if you're directly feeding the child things with cow's milk proteins in it. If there's a hypersensitivity to it or allergy, it can cause these gastrointestinal issues that cause the colicky crying. Another thing that may cause it is gastroesophageal reflux. So they're getting gastric juices from their stomach up into their throat, and it's burning and irritating. This can cause crying as well. There may be other food allergies involved in this, passed once again from the mother to the infant. And in this case, you basically have to start controlling the mother's diet if there's nursing going on, and removing things one at a time and seeing how it affects. Now, the problem with that is, especially if it's cow's milk protein sensitivity or allergy, it could take as much as 3 weeks of no use by the mother and passing to the child before you notice any difference. So it's hard to check each little thing and say, is this it, is this it, is this it, when you're talking 3 weeks before you know one way or the other. But it's better to know that and at least try than to do nothing and continue with the child constantly crying and inconsolable. So cow's milk proteins, gastroesophageal reflux, other food allergies, and then sometimes as the child is feeding, they swallow air. The air gets trapped in the stomach and in the intestines and creates discomfort. In this case, gas X or drops, infant gas drops to try to alleviate the gassiness can help relieve the pressure and take away the pain and therefore stop the crying. So these things are important to be aware of and check against. Some of the other things, some of the other measures you can try, no guarantee that any of them will work. With our child, it just took time and it eventually went away. But you may try different positions in carrying the child, on their back, on their chest, prone in the arm. You can try swaddling the infant. Sometimes that comfort of swaddling helps, or administering oral sucrose. All of these things can be at least attempted to alleviate the immediate inconsolable cry and maybe bring some relief to the infant. So that's colic, excessive crying or irritability, not to be confused with hunger cry, usually gastrointestinal issues related to some issue of diet, gastroesophageal reflux, swallowing air while eating, that sort of thing.